My name is Edward Brown. I'm an orthopedic surgeon here at Orthopaedics East in Greenville, North Carolina. I've been with the group for about the past 9 years. I came to Greenville from my service as an orthopedic surgeon with the U.S. Navy at the Naval Hospital in Bethesda, Maryland. I always wanted to have, as part of my career, being a military surgeon and to have some of the experiences for overseas deployments and other opportunities that most surgeons don't get a chance to experience before I committed myself either to a career in academics or in private practice. When I finished my service with the Navy, I was looking for different opportunities in private practice here in North Carolina. I trained, did my medical training at UNC in Chapel Hill. So I went to medical school in Chapel Hill. Did my orthopedic residency training in Chapel Hill, and my wife and I were very interested in finding opportunities to come back to North Carolina. When we looked at different practices and opportunities, we thought that the opportunities here at Orthopaedics East best fit what we were hoping to do and what we were looking for. So in my practice, some of the main areas that I have a particular interest in are in shoulder problems and shoulder surgery that would include arthroscopic procedures as well as shoulder replacements. And my two main areas of particular focus are in sports medicine and joint replacement. And within that, I have a particular focus on shoulder problems and shoulder issues. I do a lot of arthroscopic rotator cuff repair surgeries, shoulder replacement surgeries, and anterior hip replacement procedures. We've now completed over 200 anterior hip replacements for patients in my practice. Every procedure and surgery for a patient is a major event in that patient's life. And so, even if it's what we would consider an outpatient or a minor procedure, for that patient, it's a very important event in their life, and they have all the hopes in the world that it's going to go well. So when I approach patients and I talk to them, particularly about surgical procedures, I always recognize that this is a major decision in their life and something that's a very important event in their life. One of the things that attracted me to join Orthopaedics East is that I recognize that this has been a very strong orthopedic group for a long period of time, long before I arrived here. They've had some very talented surgeons who've provided excellent orthopedic care to their patients for a long time. And when I joined, I looked and saw the amount of education and training that my future partners had, and it was the kind of expectations that I held for myself and have in my own life to go obtain fellowship training, to try to be involved in the most recent technologies and procedures that we can offer to patients, and to continue that commitment to myself and my patients.